Welcome to Doctor Health Hub, where every episode begins with a doctor tip you can trust. Today, we're talking about high blood pressure, also called hypertension. I want to ask you something simple. If you check your blood pressure at home and you see 142/92, is that just stress, or is that already a dangerous problem?
Let's start from the beginning. Blood pressure is the force of your blood pushing on the walls of your arteries. When that pressure stays too high, we call it hypertension. Right now, normal is below 120/80. Elevated is when the top number is 120 to 129 and the bottom number is still under 80. Stage 1 hypertension is 130 to 139 on the top or 80 to 89 on the bottom. Stage 2 hypertension is 140 or higher on top or 90 or higher on the bottom. For most adults, our long-term goal is to bring it down and keep it under 130/80, because when you live above that for a long time, your risk of stroke, heart attack, and kidney damage goes up.
So it's not just one scary reading. It's what that number is doing to you quietly every day.
Exactly. High blood pressure is a slow injury. When that pressure keeps hitting your artery walls day after day, the inside lining of those arteries gets damaged. Over years, that damage turns into heart disease, stroke, heart failure, kidney failure, vision loss, even memory and thinking problems later in life. That's why hypertension is called a silent killer. Most people feel completely fine while the damage is already happening inside.
People always ask, why did my pressure go high? They say, I was fine in my 20s, and now I'm 40 and the numbers are scary. Why does it climb like that?
There isn't only one reason. As we get older, our arteries can get stiffer, so the heart has to push harder. Too much salt in daily food pulls extra fluid into the bloodstream, and that raises pressure. Extra body weight pushes it up. Long-term stress, not sleeping well, smoking and drinking alcohol regularly, all push it up. Certain kidney or hormone problems can raise it. Family history matters too. Some people are just wired to run high, even if they think they eat normal. And we're seeing high blood pressure earlier now, not just in older adults anymore.
Who is most at risk and really needs to pay attention?
If you've ever been told you're borderline, that already means pay attention. You're higher risk if you're overweight, if most of your food is salty or packaged, if you barely move during the day, if you drink alcohol often, if you have diabetes, if you have kidney problems, or if you had high blood pressure in pregnancy. And if someone in your family had a stroke or heart attack at a young age, you should treat your numbers very seriously.
I want to ask the question everyone asks. What are the symptoms? How do I know if I have high blood pressure?
Here's the part most people don't like to hear. Most of the time, you don't feel anything. No early alarm, no strong warning. You can walk around thinking you're fine while your arteries are under high pressure every minute. Very high numbers can sometimes cause headache, blurry vision, chest complaints, or shortness of breath, but I don't want anyone to wait for that. If you wait until you feel it, you're already in the danger zone.
Let's say I come to clinic and you check me and it's high. How do you confirm this is real hypertension and not just me being nervous in front of a doctor?
We don't diagnose you from one rushed reading. We sit you down, let you rest, use the correct cuff size, and repeat it. We're looking for a pattern. Is it 130/80 or higher again and again? A lot of the time we ask you to check at home. Here's how. Morning and evening, 2 readings each time, 1 minute apart, for at least 3 to 7 days before your next visit. We average those numbers. Home readings are often more honest than doctor office numbers because some people get nervous when they see us.
Now, I want to ask something serious. When is high blood pressure an emergency? I mean, the kind where you don't wait, you go right now.
If your blood pressure is extremely high, we're talking around 180/120 or higher, and you also have any of these, chest pain, trouble breathing, trouble speaking, weakness or numbness in the face or arm or leg, sudden vision changes, confusion, or a very sudden worst ever headache, that is an emergency. That could mean the high pressure is already hurting the heart, the brain, the eyes, or the kidneys right now. That's not, I'll sleep and check again in the morning. That's, I need urgent care now.
Let's go one step deeper. If a person ignores high blood pressure for years, what actually happens to them?
This is the part I wish every family would talk about at dinner. When you leave high blood pressure untreated, the constant force scars your arteries. Scarred arteries clog and close more easily. That's heart attack and stroke. The heart muscle gets thick and tired. That's heart failure. The tiny blood vessels in your kidneys get damaged. That's kidney failure and maybe dialysis in the future. The blood vessels in the eyes get damaged. That's vision loss. Over time, blood flow to the brain also suffers. That means higher risk of memory and thinking problems later in life. So I feel fine does not mean I am safe.
Okay, let's talk treatment. If you tell me I have high blood pressure, what happens next?
Treatment has two tracks. First track is lifestyle. Second track is medication. Lifestyle means getting the salt down. We still want you to lower sodium. Aim under about 2,300 milligrams of sodium per day and closer to 1,500 if you can, because salt pulls fluid into the bloodstream and pushes the pressure up. Move your body regularly, work toward a healthy weight, sleep enough, manage stress, limit or avoid alcohol because alcohol can raise it, don't smoke, and shift your daily food towards a heart-supportive pattern, more vegetables, fruits, beans, whole grains, nuts, seeds, lean proteins, and fewer salty instant and packaged foods. Now, medication. If you're in stage 2, meaning 140 or higher on top, or 90 or higher on the bottom, we usually start medicine plus lifestyle together right away, and we see you again in about a month to start getting that pressure under control. If you're in stage 1, 130 to 139 or 80 to 89, and your overall heart and stroke risk is low, we might try lifestyle alone first. But if it's still high after that, or you're already higher risk, we add medication. The target for most adults is to get you under 130 over 80 and keep you there long term. And one more thing, please don't stop your blood pressure medicine without talking to your doctor. Stopping suddenly can be dangerous.
How often should they come back and see you? Is this once a year, or is it more serious than that?
If you're not at goal yet, or we just started or changed your medicine, I want to see you again in about a month. We don't just hand you pills and disappear. We adjust and make sure it's working and safe. Once your pressure is stable and staying under target, most people can come every 3 to 6 months. At those visits, we're not only looking at the number, we're checking kidney labs, we're asking about chest pain or shortness of breath, we're asking about vision changes, and we're watching for side effects from the medicine. That's how we protect you long term.
Before we close, talk directly to the person who feels fine and thinks this is not their problem.
Please don't wait for a symptom. High blood pressure almost never shouts in the beginning. You have to check it. You have to know your number. Keep salt down. Move your body. Sleep. Limit alcohol. Don't smoke. Keep your follow-up. This is one of the few serious health problems in adult life that you can actually control if you respect it early.
Give us the short summary.
High blood pressure means your pressure stays too high, starting around 130 over 80. Most people feel normal, but that quiet pressure can lead to stroke, heart attack, kidney failure, vision loss, and even memory problems later in life. We confirm it with repeated calm readings, often including home readings, morning and evening, averaged over a few days. It becomes an emergency when it's extremely high, and you also have chest pain, trouble breathing, weakness in the face, arm or leg, trouble speaking, vision changes, or a sudden worst ever headache. Long-term protection comes from lowering salt, moving more, sleeping better, limiting alcohol, not smoking, managing stress, staying on medication if you need it, checking at home the right way, and following up with your doctor until you're safely controlled.
Thank you, Doctor, and thank you for watching Dr. Health Hub, where every episode begins with a doctor tip you can trust. Your health is your wealth. Stay tuned for the next doctor tip you can trust.